range of motion through flexion, extension, adduction, abduction, and internal and external rotation. So we'll start with flexion and extension. So go ahead and bring your right leg, just keeping your left leg down. Go ahead and raise your right leg in a straight line. Any pain or discomfort?
No.
Good. Okay, lower it back down. Now we'll bring it up and we'll move it through just a little bit more range of motion. Any pain or discomfort?
No.
Good. Alright, so we'll bring it up. We're going to lay the goniometer with the stationary arm right at the and the base right at the greater trochanter. Alright, so we'll go ahead and raise up that leg again for me. Good. You're good. Any pain, discomfort? We get to that hard end feel. Beautiful. So we got about 85 degrees range of motion with that one. So pretty close to 90, but not quite there. And we'll go ahead and flip on your back. We'll measure through hip extension. So go ahead and take that left leg up for me now without raising your right. Good. Any pain or discomfort? Good. So again, we'll kind of keep that base arm pointing straight. Excuse me, pointing straight through at the hip, starting with the greater trochanter. This guy's coming right here. And we'll go ahead and raise it up for me, keeping that pelvis. And as soon as I see that pelvis start to move, that's when we're going to stop. So range of motion, we've got just about 50 degrees, 15 degrees. Range of motion, no, that's not right, not 15, sorry. Go ahead, bring that back up for me. We'll do that one more time. Raise that up. Good. All right, we'll go ahead and lower it down so we're making sure that pelvis doesn't move. All right, here we go. We'll start with raising it up. Perfect. And push it just a little bit more. Good. So on this one, lower it back down. And again, we look at the goniometer, and we get about 50 degrees range of motion with that hip extension. All right, next thing we're going to do, staying right on your stomach, we're going to assess internal and external, internal and external rotation. So go ahead and flex your right knee for me, all the way, 90 degrees, good. And we're going to rotate it out towards me. Any pain with that? Good. All right, so go ahead and bring it back towards center. So with this one, we're going to keep the stationary arm right in line with the pelvis. We're going to rotate out, keeping that femur down. We see we got it tracking right up with there. Out, 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 out. Actually quite a bit range of motion here. Good, and we see it. We got about 58 degrees there. Now we'll take it in the other way, so go ahead and flex that knee for me. Good, rotating the leg inward, keeping the pelvis down. We'll come back, so we'll try to do this with keeping that pelvis locked. Good, so a little bit less on that external range of motion. Bring it back towards the center. Good, now we'll measure it out. So at this time, we kind of got a gauge for it, so set the goniometer up first. And we're going to push in. Good. Keeping that pelvis down. All right, so we've got just about, actually quite a bit of range of motion here for that external. We've got 58 degrees on the external. All right, our last one that we're going to do, come on down, flip onto your stomach, and we're going to have you slide on down to the edge.
Knees off.
Yes, legs off.
Sit up.
Sit up. Alright. Adduction and abduction. Wait, no. You gotta go back to this one. Sorry. On your back. We'll flip onto your side. Good. So we'll take it out. We're going to first start with adduction. Good. Alright, so we're going to try to actually keep a neutral pelvis for these ones now. So when you raise it up, good. Try to bring that leg just a little bit more posterior. There you go. So we're looking right now at the abduction, how we're going to measure it. We're going to start with the goniometer right here at the pelvis. Good. So go ahead, raise that up for me. Good, good, good. Quite a lot range of motion actually. Good, you can go ahead and lower it. And we're looking right here, we've got 78 degrees range of motion, great. And we'll go ahead, lay right back on your stomach, or on your back. Good, now for the adduction, how we're going to measure this, we're going to take your right leg up, and we're going to cross it over. So you will find that you might hit that inner thigh on the other leg for me, so keeping this leg straight. Good, and we'll bring it back. Any pain with that? Okay. Now last one we're going to measure right here. We'll take it in. We're going to start with goniometer right at the hip. Go ahead and raise that right leg and bring it in. Good, keeping both hips down. And hit that firm end feel. Perfect. Go ahead and stop. And we